In a dose response relationship, we try to understand here the relationship that exists between the effects of the drug to the body and relating it to the dose of the drugs. Also, you have able to learn how we can graphically represent this kind of relationship, which we call it as the dose response curve. Recall that by definition, a dose response relationship, this is a systematic description of the extent of the effect, the degree of the effect of a drug as a function of its dose. Let's say, for example, you have a drug, a calcium channel blocker. Specifically, an example of a calcium channel blocker is amlodipine. Please take note that calcium channel blockers, these are classified as antihypertensive agents. And when we say antihypertensive agents, they can somehow lower the elevated blood pressure level. That is the effect of an antihypertensive agent. They can lower the elevated blood pressure level. So let's say, for instance, at 5 milligram of the drug amlodipine, at this particular dose, amlodipine will now have a certain, will now cause a certain reduction of blood pressure. So there has to be an existing relationship between this dose and the extent, how extent is the degree of reduction of the blood pressure being achieved. Therefore, we can realize here that if there is an increase, no, if there is an increase of the dose from 5 milligram to, let's say, 10 milligram of that drug amlodipine, there will now have a definite increase in the degree of reduction of blood pressure compared to the effect of the drug with 5 milligram dose. So there's really an existing relationship between dose and effect of the drug or dose response of a drug. In general, the more the dose of a drug, the more is the response which is achieved. All right? The greater the dose, the greater is the effect of the drug achieved. But at a certain time, there are cases na increasing the dose will bring about certain adverse effects of drugs. Or maybe it may bring effects of the drug that is not achieved at all. So we will try to understand into all of this in this lesson. But again, please take note in general, the dose of the drug will be proportional to the kind of therapeutic effect that will be achieved. And again, the existing relationship of dose response or dose to that of response can be easily illustrated through a systematic graph, which we call it as a dose response curve. Okay, let's recall this curve, the importance of this curve. In this curve, the x-axis again plots the dose of the drug, which is usually expressed in a logarithmic scale. That is why this is sometimes referred to as log dose. And the y-axis, particularly, it plots the response, or this is also equivalent to the measured effect of the drug, or that could be the efficacy of the drug. And this particular line here, traced in a red colored line, this will be the dose response curve. Okay, that would be the dose response curve that we usually plot in order for us to understand certain aspects about that particular drug. Say, for example, with that particular dose response curve, we can be able to determine the efficacy, no, the efficacy of a certain drug. Okay, or this is the maximal, that is the maximal achievable response to a drug. All right. Again, with this dose response curve, we can be able to um, understand the certain aspects of a drug. So, say for example, we have efficacy, the maximal achievable response to a drug. We also have potency. Now, potency, that is the dose that is required to achieve 50% of the maximum response. So for this certain dose response curve, we can plot here at this particular um, portion would be the potency. Again, potency, that would be the dose required to achieve 50% of the maximum response, meaning the biomarker here would be the 50% effective concentration, all right, to achieve the half of the maximum response. And we also have the ceiling dose, no, the smallest dose that produces the maximum response. And this particular line here would be the slope. Okay, that would be the slope. And I have already um, I mentioned last meeting that for the slope, it only describes the degree of change, the extent of change in the response or in the effect of drug. If there is a slight change in the dose, well, it actually matters if the slope that resulted in a systematic graph is a steep one or a non-steep. So let's have, for example, this is a non-steep or not steep slope versus a steep one. Okay. And if we compare a steep and a non-steep versus that of a non-steep, for a steep slope, a very steep slope, with a very with just a small no adjustment or slight adjustment of that concentration of a drug, there is already a drastic um, change in the response. If you observe from 1 milligram, then we try to, let's say, add a very slight um, additional of the dose. If there is a slight change in the dose, as you can see, the response is so, the change in the response is so drastic. No, from this response to a higher gap of response. So obviously, for a steep graph slope, that would help us realize that that particular drug, if there is already a change in a dose, a slight change in a dose, that could cause harmful effects, adverse effects, toxic effects, okay, that may produce to that could produce in the body. But for a non-steep, here you have a non-steep slope. Let's say you have a 1 milligram of a drug, then here would be a 2 milligram. Even uh, we cause no an alteration in a dose by increasing a one, let's say 1 milligram of that 1 milligram, additional 1 milligram of that dose. As you can see, there is only a slight change on the response of a drug. Okay, so that would be the importance of the slope in this aspect of dose response relationship. Okay, so let's go back to this graph. As shown also in the graph above, we can observe the definite proportional relationship between an increasing dose. You have an increasing dose going to the right, no, and its relationship to the increasing response or magnitude of its effect. no? As shown also by this dose response curve. No? With this dose response curve, we could really see the relationship of the increasing dose and the increasing magnitude of effect. In particular, this graph, this graph being illustrated is particularly a graded dose response type of curve. Okay, again, this particular graph illustrated is particularly a type of graded dose response curve. Again, in a graded dose response graph, it plots here the response. Okay, you have the response to a drug against its concentration or dose of a drug. Okay, there is a gradual increase in the pharmacologic effect if there is an increase in the dose. Now, this type of curve can be applied in many ways. It can be used to plot results of many kinds of experiments. Example, in determining efficacy of a drug, in determining potency of a drug. Another, this can also be applied in comparison of the responses to a drug, which is a full agonist, a partial agonist, an inverse agonist, or even a neutral antagonist. Also, uh, this can be applied in studying a uh, a drug in the presence of a competitive antagonist or a drug in the presence of a non-competitive antagonist, right? So let's have, for example, applying this dose response curve in determining efficacy of a drug and the potency of a drug. So you have a drugs, three drugs ABC, and it already shown in this graph their dose response curve. Uh, in order for us to interpret this, let's start, for instance, the efficacy of the three. Which of the how do we um, identify the who is which is much more efficacious among the three? Okay, so as shown in the graph plotted na dose response curve, we can realize here that drug A and C is equally effective, meaning they have the same efficacy. Okay, and when with drug B, this would be the drug with the lesser efficacy among the three. Okay, then for the potency, the most potent among the three would be drug B. I know drug A. I'm sorry. Okay, and then followed by we have drug B and pinaka-list potent it would be drug C. So this is how do we identify the efficacy and potency of a drug being plotted in a dose response curve. Okay, let's have another example. We have here drug ABC again, but this time with a different curve being plotted. For this given example, you have a drug A and B with the same um, measure of efficacy. Okay, therefore, we could say that for efficacy, drug A and B has the same efficacy, whereas drug C again will have the least um, efficacy or lower efficacy among the three. Now, when it comes to potency, the most potent between the three again would be drug A, but this time um, it is more potent than drug B, although they have the same efficacy. Okay, so let's try to find out why. Okay, from this maximal response of drug A, okay, 50% of the maximal response, this would be the dose that is required. Okay, so this would be the potency of drug A comparing to the potency of drug B. it will require a much more greater dose to achieve its 50% of the maximal response for drug B. That is why more potent would be drug A, and the least potent would be drug C. All right. So that is how again to interpret efficacy. No, the dose response curve if you are asked to determine the efficacy of the drug or the potency of a drug. So with this idea, we can realize no that a drug that is potent, it does not mean it is already efficacious, or vice versa. A drug that is efficacious, it does not mean that it is already a potent drug. Alright. Now another application of the dose response graded dose response curve is comparing the responses of a drug if it is a full, a partial, inverse agonist. Recall that we defined these three based on their differences in intrinsic activity. Particularly, we used a hypothetical quantal unit in describing the intrinsic activity of a full partial inverse agonist. For a full agonist, its intrinsic activity would be 1. For partial, it would be greater than 1, but I know not greater than 1, less than 1, I mean. Okay, less than 1, but it is greater than um, 0. Okay, ayan. Okay, that would be for partial agonist. And for the inverse agonist, it would be less than less than 0. All right. So that is how we differentiate the three based on their quantal unit of intrinsic activity. Now, given the um, concept, okay, having the knowledge on the dose response curve, our biomarker here would be the response only. Okay, because the intrinsic activity, it has something to do with the um, activity towards stimulation of the receptor. Okay, and that is only the aspect where this three differs, okay, on their ability to stimulate the receptor, the active site of the receptor. All right, now for the full agonist, it says here that the intrinsic activity is 1, and we assumed here that it would be the maximal, no, maximal effect. Therefore, for for a full agonist, you have this particular dose response curve. Okay, you have this curve for full agonist where it attains the full pharmacologic effect. All right. Then for the partial agonist, you have a red line. You have a curve on a red line. Ayan. So as you can see, its response here is less than, no, full, less than the full agonist. Okay, but greater than 0. No? So greater than 0, here is the biomarker 0. Greater than 0 but less than the maximal response. Okay, so this would be for partial. And for an inverse agonist, recall that we quantify its unit intrinsic activity, quantal unit as less than 0. That is why from this basal, no, from this basal activity, the plotted inverse agonist curve is below 0. Okay, so that is how we plot, okay, the intrinsic activities of full agonist, partial agonist, inverse agonist using this dose response curve. All right, so this is inverse. What about the neutral antagonist? Well, neutral antagonist, as defined, it has no receptor activity. Okay, so no receptor activity. That is why it would have a plot. Okay, in here. So that would be the neutral antagonist, zero intrinsic activity, no receptor activity. So that is how we apply this curve towards the comparison of the intrinsic activities of an agonist and a antagonist. Okay, this time, let's have another application of this dose response curve, particularly in studying a drug in the presence of antagonists. And we have two types of antagonists. We have a competitive and a non-competitive antagonist. All right. So let's say, for example, and you have um, you'd have the first curve. Uh, this one, the first curve line, um, which is traced in a blue-colored pen. That is that would be the plotted line um, for an agonist alone, okay, achieving this particular response. All right, you have there an agonist alone, okay, showing its plotted line, achieving its maximal efficacy. Now, uh, in the presence of a competitive antagonist, okay, when you say competitive antagonist, it can be surmountable, right? Again, recall your notes about competitive antagonist. When I say competitive antagonist, its effect, no, its antagonism effect can be surmounted if we increase the dose of the agonist. That is why on the second curve, plotted curve, we increase the dose, right? We increase the dose because from here, okay, from this um, basal, no, from this initial um, dose of agonist alone, okay, you have the second curve wherein it shifted on the right, okay, of the right of the x-axis, no. So from that, nag-increase tayo ng dose, okay, para somehow ma-surmount yung effect ng presence of a competitive antagonist. That is why what is being shown in the graph is you have here an agonist, the same agonist, okay, from the first curve, plus a competitive antagonist. Okay, you have an agonist uh, in higher concentration, no? With increased concentration, plus a competitive agonist surmounting the effect, okay, overcoming the effect of the competitive agonist. That is why the effect of the agonist is the same. Okay, it still attains the same effect, same maximal effect. It only shifted to the right, knowing that we have to increase di ba? We have to increase the dose of the agonist in order to surmount, in order to overcome the effect of this competitive antagonist. That is why ang effect ng antagonist is not uh, uh, straight line lang siya, hindi siya observable in this graph. Okay? Hindi niya napababa yung original na maximum effect ng una. Okay? So the same effect, it only shifted to the right, knowing now we have to increase the dose of the agonist para ma-surmount natin yung activity ng competitive antagonist. So if you happen to um, uh, sh- um, if you happen to observe this example, a kind of graph, okay, in this illustration, this is probably an example of a drug in the presence of a competitive antagonist. Okay, kapag nakakita ka ng graph na parehas lang mula sa agonist alone, you have a drug alone, tapos you have another drug in the presence of antagonist, tapos same lang yung efficacy, and then for the second curve, nag-increase ka ng dose but same efficacy. This is an example, no, of a drug in the presence, plotting a drug effect in the presence of a competitive antagonist. Alright? Um, Paano naman kapag you have a drug but this time a non-competitive antagonist? This time, kapag non-competitive antagonist, recall that the effect this time of the antagonism effect is not surmountable already. It is irreversible. Okay, irreversible. It cannot be overcome even by increasing the dose of the agonist. That is why here from the plot, you have originally an agonist alone muna. Then, sa isang plot curve, okay, plot line, ano yung nangyari dito? Bakit lesser, di ba? From this maximal effect niya, lesser na ngayon yung effect ng agonist in the presence of irreversible antagonist. Recall that an irreversible antagonist, hindi natin kayang um, pigilan yung antagonism niya. Knowing na ang isang non-competitive antagonist, ang involved here is an allosteric antagonism. So kahit ano pang increase natin sa dose, okay, we cannot surmount the effect of this irreversible antagonist. That is why from effect, agonist effect, um, na counteract, no? Ni irreversible or ni non-competitive antagonist yung effect ng agonist. Kaya, bumaba. Okay? Bumaba to halos less than 50, no, of the efficacy. Okay? Napababa niya yung activity ng agonist. Again, in the presence of a non-competitive antagonist, non-surmountable, no? Non-surmountable yung effect niya. Okay? Talagang na-antagonize niya yung activity ni agonist. Okay? And that is shown in this illustration. Okay? Kahit anong increase pa natin sa dose, nag-shift, kahit anong shift, or kahit hindi ka mag-shift to the right, bababa yung effect ng agonist. Alright? So, ito kalaki yung pagbaba. No? Ito kalaki yung pagbaba ng effect sa agonist. Diba? Mula sa maximal, ito yung maximal with agonist na plus a irreversible antagonist, bumaba na yung efficacy ng agonist. Na-antagonize ba? Na-block niya yung effect ng agonist. Alright? So that is how we apply these graded dose response curve. Again, the graded dose response curves in general, it show effects on a continuous scale. Okay? And it also shows the intensity of effect na proportional to that of the dose. Alright, so that would be the graded dose curve in general. You have a continuous scale, the intensity of effect proportional siya to the dose. This time, let us proceed to the quantal dose-response relationship. This particularly describes the distribution. No? By definition, this is the distribution of minimum dose of a drug required to produce a defined degree of a specific response in a population of subjects. So here, we are looking more on the population dynamics. Again, sa quantal dose response relationship, we are much more concerned here on the population dynamics, the quantal dose effect. Okay? Or the all or none. Okay, dose effect. This is also known as all or none dose response or dose effect relationship. Okay, quantal dose effect relationship is also known as all or none dose effect curve. Kasi sa relationship na to, quantal dose relationship, it describes a drug effect which is binary. Pwedeng present, okay, for a group of population, pwedeng absent sa group of population. No, unlike the graded dose response, here we are not concerned sa specific degree of response. We are not concerned here specifically with how much degree of response being achieved. Say, for example, in the earlier specific example in the case of calcium channel blocker earlier, di ba? Kanina, we have we have relate na yung somehow merong relationship yung dose ng calcium channel blocker amlodipine towards its relationship if we increase no the dose of the um, drug amlodipine may increase doon yung effect. Now this time we are not concerned here of how much extent no, how much extent or how much degree is the reduction this time of blood pressure achieved for calcium channel blocker for example. No, hindi tayo focus more sa degree, gaano ba ka-extent yung uh, a reduction, yung degree ng reduction of blood pressure for a drug amlodipine, for example. Okay? Particularly in a quantal dose response curve, the graph here does not show absolute numbers for the degree of response. Okay, relating to the dose. Instead, the graph here plots the frequency or the percentage of individuals showing an effect. Okay? Gaano karami yung individual showing an effect as a function of its dose. That is why in this quantal dose response curve on its y-axis, it plots here the cumulative, okay, cumulative number of patients, okay, and so we have here sa y-axis you have a cumulative number of patients, or we have here on the y-axis the rate of an outcome occurrence in a group of population. Then we relate it on the drug dose. Okay, so we have the dose on the x-axis again. In a quantal dose response curve on the y-axis, we have the rate of an outcome occurrence in a population against the drug dose on the x-axis. Now, that outcome occurrence observed in a group of population given a certain dose of a drug, it can either be a therapeutic, okay, pwede yan therapeutic effect, okay, or upon increasing now the dose, upon increasing the dose, that might bring about certain adverse effects to a cumulative number of patients. All right. In short, sa quantal dose response curve, okay, sa quantal dose response curve, it only plots here the response of a drug to a group of respondents, okay, response ng isang drug to a group of respondents showing a therapeutic effect or a toxic effect as a function of its dose. So yung makikita lang natin na graph dito, say for example, at this particular dose, sorry. Okay, at this particular dose, you have here, ayan. Okay, you have for instance, ito yung therapeutic effect. Then, upon increasing, of course, di ba, sobrang increase ng dose, most probably, this would be the toxic effect, okay, of a drug. Ayan. So, yan yung nakikita lang natin sa dose response curve. It only plots the response of a drug, response ng isang drug to a group of respondents, to a cumulative number of patients, showing a therapeutic effect, okay, or a toxic effect, okay, as a function of its dose. Now, let us proceed to the different aspects or parameters involved in the quantal dose relationship curve. First, we have here Okay, first one we have the ED50. All right. So una we have ED50. ED50, this is also known as the median effective dose. All right. Again, ED50 is the median effective dose. This is the effective dose in 50% of the given population. Again, this is the effective dose in 50% of the given group of population. Okay. So in this particular quantal dose response curve, the ED50 would then be um, uh, on this part. Okay, this would be the ED50. Okay, the 50%. This would be the effective dose. Okay, this would be the effective dose needed, required, okay, among, not required, but being observed, no, effective dose that is observed in 50%, okay, of the given population. Okay, example, we have 100 total of population, 50% of that, okay, uh, ano ba yung observable effective dose sa kanila? Okay, so that would be the effective dose, median effective dose. All right. The other parameter is the TD50. Ito naman yung median toxic dose. Okay, the median toxic dose, ito naman yung toxic dose in 50% of the given population. Okay, again, median effective dose. This would be the dose in 50%, okay, of the given population. So in this dose response curve, this would be the TD50. Okay. Again, it is the dose required to produce a particular toxic effect in 50% of the population. All right. Another parameter, which is also very important in a quantal dose response curve, is the therapeutic index. Okay, the therapeutic index, this measures the relative safety of a drug. Again, this measures the relative safety of the drug. Okay, and in order to determine the therapeutic index, you have to know the formula for therapeutic index. So to determine the therapeutic index, you simply determine the ratio of the dose that produces toxicity to that of the dose that produces the desired or the clinical desired response or effective response. So this is how we get the therapeutic index CD50 over ED50, the ratio between the dose that produces toxicity to that of the dose that produces the clinically desired response. And you have to take note here that the greater index, therapeutic index, by the way, therapeutic index, yung symbol niya is letter I. Okay, that's why I wrote letter I. Okay, therapeutic index, it has a symbol of letter I. Please take note that the greater therapeutic index value, that is considered a more favorable drug, a safer drug. Okay? Pag sobrang laki ng therapeutic index, okay, favorable yung drug, safer yung drug. Okay, saan natin makikita yung therapeutic index? Um, this part here, okay, itong part na to, ito yung therapeutic index. Okay? Itong part na yan. So kung sobrang laki ng therapeutic index, that would mean safer yung drug. Kasi kahit may slight changes or bigger changes sa dose, no, ng drug, within therapeutic effect pa rin yung observable, okay, na responses. Unlike a very small value ng therapeutic index, kapag lower yung therapeutic index, sobrang lapit ng therapeutic effect tapos toxic effect. Kapag may slight changes lang ng dose dyan, most probably, uh, that drug will now produce certain harmful effects, adverse effects, side effects. So, delikado. That's why meron tayong mga tinatawag na mga narrow therapeutic index na drugs, no? Narrow therapeutic index na drug. Example doon would be yung digoxin, no? Example of a narrow, na sobrang narrow ng therapeutic index ng mga drugs na yan. We have digoxin. Okay. Another example is warfarin. These are the most common. Okay. Lithium, ayan. Lithium, theophylline. Yan. Yan yung mga few common examples ng drugs with a narrow, no, narrow therapeutic index. Okay? Kaya upon administration of these drugs, kailangan talaga ng drug monitoring. Okay, kailangan gud i-monitor ang usa ka patient taking this particular drugs. Kay kung naalang gali gamay nga changes sa ilahang dose, sa concentration ng drug nila in their blood, in their serum level, most probable daghan na kaayo dayon mga adverse effects nga manunga. Okay, so delikado ni sila nga mga drug if walang proper monitoring. Alright? And lastly, okay, another, although dili kayo ni siya applicable sa pharmacology, but this is very important in clinical toxicology. So, under quantal dose response curve, yung margin of safety. Margin of safety, ito naman, ganun din ratio ng dose of a drug that produces toxicity to that of the dose that produces clinical desired response. Pero this time, TD99 na to, TD99 over ED1. Okay? So this is how we determine the margin of safety. Okay? This time, TD99 over ED50, meaning yung toxic dose, no, toxic dose in 99% of a given population divided to the effective dose sa 1% lang ng population. Okay? But again, this is more applicable to clinical toxicology. Okay? So yung much more applied ng mga parameters are the first three. Okay? So say for example, you have, ayan, say for example, for this given quantal dose response curve, syempre yung first na plotted curve would be for the therapeutic beneficial effect. Okay, example, yung drug na to would be an anti-allergic drug. Okay, so at this plotted curve, no, na ay subsidization na sa allergies. So nag-allergies subside. Okay, example ha, isa tong anti-allergy nga drug ang ato ang determine here. Okay, test siya ba for a group of cumulative number of patients. Then for its toxic effect, let's say yung first toxic effect at that particular plotted curve, I'm sorry. Ayan. At this particular plotted curve, we have the, for example, ano bang example ng adverse effect ng anti-allergy? Let's say, for example lang, hypothetical, nausea and vomiting, no? At this particular curve, nagkaroon na siya ng mga toxic effect na nausea and vomiting. So, example lang yan. Okay. Now you are asked to find the therapeutic index. Yung tanong, you are asked to find the therapeutic index. No, therapeutic index. Paano nga ulit kunin yung therapeutic index? Therapeutic index, that is the ratio of TD 50 over ED 50. Okay, so you have to plot first. Saang, ano ba yan, saang dose dito, yung toxic dose, okay, in 50% of a given population, saan naman yung effective dose in 50% of a given population. So 50% of the given population, then you plot for its therapeutic dose, no, effective dose. So this would be the ED, no, ED 50, which is 10. Let's say milligram na siya in milligrams, yung dose nila. Okay? Then for the um ayan, for the toxic dose, ayan, you have 25. So divide nyo lang yan. This would be the TD 50, ED 50. Okay? So the therapeutic index for this given sample would be ilan ba? 25 milligram divide 10. No? 10 milligram. That would be 2.5. Diba? Tama? That would be the value, no, of its therapeutic index. Okay? So, yung gap pala dito, no? Okay, 2.5, no, therapeutic index. So, ang group of patient na yan, every day kung take sila og more than, no, from that effective dose, then ilang sagunsunan og additional 2.5 from that dose, na ay within pa na siya, no? Within pa na siya sa therapeutic effect. Pero more than, mulapas na gani na, okay, that might somehow cause um, toxic effects already. Okay? So, yan yung importance ng therapeutic index. So, kung sobrang liit lang ng value ng therapeutic index, no, that would mean sobrang narrow ng safety ng drug na yan. Okay, let's say less than 1, ayan, lang yung therapeutic index. So, very needed, no, highly recommended yung drug monitoring for that particular drug. Okay? Kasi sobrang delikado kapag may slight changes na sa drug dose na yan. Okay? If ang drug na yan may narrow therapeutic index, konting change lang sa dose, meron ng probable na side effects, adverse effects, or harmful effects. Alright? So, this is how we apply the quantal dose curve. Again, in a quantal dose response, nga graph, it only plot the rate of an outcome occurrence. Rate of an outcome occurrence in a group of population against that drug dose. Alright?